Hello, everyone. Welcome back to Real Talk English. I'm Emily, and today we're talking about something that can be really stressful when you're in an English-speaking country, going to the pharmacy.
Hey everyone, I'm Daniel, and yeah, this is one of those situations where you really need to communicate clearly because it's about your health. But so many learners get nervous and end up just pointing at things or leaving without the right medicine.
Oh my gosh, I've heard so many stories about this. Just last week, a student told me she went to a pharmacy with a terrible headache, but she was too embarrassed to describe her symptoms. She just said, medicine for head, and the pharmacist was so confused, didn't know if she meant a headache, head injury, scalp problem, or what.
Exactly, and that's the thing. You can't just say, I need medicine. You need to be specific about your symptoms, explain how long you've had them, and understand what the pharmacist is asking you. These conversations are actually pretty predictable once you know the right phrases.
Right, and this isn't just about buying medicine. You might need to ask for advice about over-the-counter medications, understand dosage instructions, or even describe allergies. These are essential life skills when you're living, working, or traveling in English-speaking countries.
Plus, pharmacists in places like the US, UK, Australia, and Canada are actually really helpful. They can often solve minor health issues without you needing to see a doctor, which saves time and money, but you have to be able to communicate with them.
So, in today's episode, we're going to cover everything you need to know. We'll teach you how to describe common health problems like colds, headaches, stomach issues, and allergies. We'll show you how to ask for specific medicines, understand dosage instructions, and answer the pharmacist's questions.
We'll also cover the difference between prescription and over-the-counter medicine, how to ask about side effects, and what to say if you have allergies or are taking other medications. Plus, we've got our vocabulary breakdown and practice challenges.
By the end of this episode, you'll be able to walk into any pharmacy confidently and get exactly what you need. Let's get started. All right, let's jump into a real pharmacy scenario. Imagine I'm the customer and you're the pharmacist. I walk up to the counter looking pretty miserable. What would you say?
I'd start with, "Hi there, how can I help you today?" That's the standard pharmacy greeting. Now, how would you respond?
Okay, so let's say I have a cold. I might say, "Hi, I'm looking for something for a cold. I've been feeling really congested and I have a sore throat."
Perfect. Now, as the pharmacist, I'd ask some follow-up questions. Okay, how long have you been experiencing these symptoms?
Good question. I'd say, "I've had it for about 3 days now and it's getting worse."
Got it. Now, I might ask, are you taking any other medications or do you have any allergies I should know about?
Oh, this is important. I'd say, "No, I'm not taking anything else right now and I don't have any allergies."
Perfect. Now I'd make a recommendation. Okay, I'd recommend this cold and flu medication. It'll help with the congestion and sore throat. You'll want to take 2 tablets every 6 hours and make sure you take them with food.
Wait, let me make sure I understand. So, how do I confirm the dosage?
Good question. You could ask, just to confirm, I should take 2 tablets every 6 hours with food, right?
Excellent. Now, what if I want to know about side effects? How do I ask that?
You'd say, are there any side effects I should watch out for? Or more casually, are there any side effects I should know about?
And what might you say as the pharmacist?
I'd say, this medication might make you drowsy, so avoid driving after taking it. Also, don't take it on an empty stomach or you might feel nauseous, and make sure to finish the full course even if you start feeling better.
Great. Now let's talk about a different scenario. What if I need something more specific, like for allergies?
Okay, so you'd walk up and say, "Hi, I'm suffering from seasonal allergies. My eyes are really itchy and I can't stop sneezing. Do you have anything that can help?"
And what about stomach problems? That's another common one that people are often embarrassed to describe.
Right, so you could say, "I've been having stomach trouble. I think I ate something that didn't agree with me. Do you have something for an upset stomach?"
That's good. It's specific enough to get help, but not overly detailed. What about if I need to explain symptoms more clearly?
You might need to say, "I've been experiencing diarrhea and stomach cramps since last night." Or, "I have heartburn that keeps coming back even after eating."
Okay, now here's a tricky one. What about prescription medications? How do I ask about those?
Good question. If you have a prescription from a doctor, you'd say, "Hi, I need to fill a prescription." Then hand them the prescription paper or tell them your doctor sent it electronically.
And what if I need a refill of something I take regularly?
You'd say, "Hi, I need a refill on my blood pressure medication," or "I'm here to refill my prescription for medication name."
What about if I can't remember the name of the medicine?
That's super common. You'd say, "I take something for my allergies, but I can't remember the name. It's a small white pill that I take once daily." Or better yet, "I have it written down somewhere. Let me check my phone."
Really good advice. Now, before we move to the vocabulary section, what are the biggest mistakes you see learners make?
The first one is being too vague. Saying "I feel bad" or "I'm sick" doesn't help the pharmacist help you. Be specific. Is it your head, stomach, throat? What exactly are you feeling?
What's another mistake?
Not asking questions when you don't understand. If the pharmacist gives you instructions and you're not sure, ask them to repeat or clarify. It's about your health. There are no stupid questions. Say, "Sorry, could you repeat that?" Or, "I want to make sure I understand. How many should I take?" And one more, not mentioning allergies or other medications. This is really important. Drug interactions can be dangerous. Always tell the pharmacist what else you're taking, even vitamins or herbal supplements.
Such important advice. All right, let's break down all that vocabulary now. Time for our vocabulary breakdown. These words and phrases are essential for pharmacy conversations.
Let's go through them.
First, I'm looking for something for condition.
This is the most natural way to ask for medicine in English. Example, "I'm looking for something for a headache," or "I'm looking for something for allergies."
More natural than "I want medicine for" or "I need to buy medicine for." Works for any health issue. You can also say, "Do you have something for?" which is slightly more formal.
Second, how long have you been experiencing these symptoms?
Standard medical question about symptom duration. Experiencing is formal medical vocabulary for having. Example answers, for about 2 days, since yesterday, about a week now.
Pharmacists and doctors always ask this because treatment depends on how long you've been sick. Acute, sudden, short conditions versus chronic, long-term, ongoing conditions need different approaches.
Third, I've had it for time period.
Correct grammar for describing symptom duration. Use present perfect tense, "I've had," not "I have," for ongoing situations. Example, "I've had this cough for 5 days."
Use for with duration for 3 days, for a week, and since with starting points, since Monday, since last week. Common mistake, "I have it 3 days." Wrong, must be "I've had it for 3 days."
Fourth, are you taking any other medications?
Critical safety question about current drugs you're taking. Medications is formal medical term. More casual, are you on any other medications or do you take any other medicines?
Always answer honestly. Include prescription drugs, over-the-counter medicines, vitamins, supplements, herbal remedies. Drug interactions can be dangerous. Example answer, "Yes, I take blood pressure medication," or "No, nothing else."
Fifth, I'd recommend, you'll want to take.
Pharmacist language for suggestions and dosage instructions. I'd recommend this one equals professional advice. You'll want to take 2 pills equals friendly instruction that's still important to follow.
Less forceful than you must take, but equally important. Other phrases, I suggest, this should work well. The dosage is, listen carefully to these instructions.
Sixth, just to confirm.
Perfect phrase for double-checking important information. Shows you're being careful and want clarity. Example, just to confirm, I take 1 tablet 3 times a day?
Especially important for dosages, timing, side effects, and storage instructions. Alternatives are, "Let me make sure I have this right." So just to be clear, can I confirm that? Can I confirm that?
Seventh, are there any side effects I should watch out for?
How to ask about potential negative medicine reactions. Side effects equals unwanted symptoms from medication. Watch out for equals be aware of, pay attention to, monitor.
Common side effects include drowsiness, dizziness, nausea, dry mouth, headache. Pharmacists will warn you about important ones. You can also ask, what side effects are common, or should I be worried about anything?
Eighth, don't take it on an empty stomach.
Instruction to eat before taking medicine. Empty stomach equals haven't eaten recently, typically 2+ hours since last meal. Some medicines can cause nausea or damage stomach lining if taken without food.
Opposite instructions: take with food, take after eating, take during or after a meal. Some medicines work better on empty stomachs. Pharmacists will specify. Always follow these instructions.
Ninth, I'm suffering from condition.
Formal way to describe health problems implies significant discomfort. Suffering from is stronger than I have. Example, I'm suffering from chronic migraines, or I'm suffering from insomnia.
Use for allergies, pain, chronic conditions, serious symptoms. For minor issues, I have is fine, like I have a slight headache. Suffering emphasizes impact on your life.
10th, I've been having body part trouble.
Polite, somewhat vague way to describe problems with a body part or system. Stomach trouble equals digestive issues without being too specific. Back trouble equals back pain or problems.
Good when you're not sure of medical terms or want to be less graphic. Examples: heart trouble, breathing trouble, sleeping trouble. The pharmacist will ask for details if needed.
11th, refill a prescription.
Fill equals get medicine from a new prescription. Refill equals get more of medicine you already take. Example, I need to fill this prescription my doctor gave me, or I need a refill on my diabetes medication.
Don't say buy a prescription. Prescriptions are doctor's orders, not products. British English sometimes says collect a prescription. You might need to show ID for controlled substances.
And finally, over-the-counter, OTC, versus prescription.
Over-the-counter, or OTC, is medicine you can buy without a doctor's prescription. Examples: pain relievers, allergy medicine, cough syrup.
Prescription, or RX, requires doctor's authorization. In conversations, is this available over the counter, or do I need a prescription for this? OTC medicines are usually milder, safer for self-treatment. Stronger medicines need prescriptions to prevent misuse.
These phrases will cover most pharmacy situations. Remember to speak clearly, ask questions when unsure, and always mention allergies. All right, everyone, practice time. These challenges will prepare you for real pharmacy visits.
Challenge 1. Write your medical profile. Create a short document on your phone with your allergies, current medications, chronic conditions, and recent medical procedures. Include English translations of medication names. Keep this handy for pharmacy or doctor visits.
This is incredibly practical. It saves time and prevents miscommunication. Update it whenever your medications change.
Challenge 2. Describe these symptoms out loud. Pause and practice saying these in English. 1. You have a headache that started this morning. 2. You've had a cough for 3 days. 3. You have seasonal allergies making your eyes itchy. 4. You ate something bad and have an upset stomach.
Use the phrases from today. I'm looking for something for. I've had it for. I'm suffering from. Actually speak out loud, not just think it.
Challenge 3. Role play with a friend or language partner. Take turns being the pharmacist and customer. Practice these scenarios: buying cold medicine, asking about side effects, refilling a prescription, describing stomach problems.
If you don't have a partner, record yourself playing both roles. This helps you practice the back and forth conversation flow.
Challenge 4. Learn common medicine names. Look up the English names for medicines you take or might need. Pain relievers like aspirin, ibuprofen, acetaminophen, antihistamines for allergies, antacids for stomach, cough suppressants.
Different countries use different brand names, but the active ingredient names are usually similar. Knowing both helps you find what you need anywhere.
Challenge 5. Visit a pharmacy for practice. Even if you don't need anything, go to a pharmacy and ask a simple question like, where is the pain reliever section, or do you have throat lozenges? This builds confidence in low-pressure situations.
And here's a confidence tip. Remember that pharmacists want to help you.
They're trained to handle communication with people from all backgrounds. Don't be embarrassed about your English. Your health is more important.
Exactly. And most pharmacists are patient and will work with you to understand your needs. Clear communication is more important than perfect grammar.
That's it for today's episode. Let's recap. Going to the pharmacy in English doesn't have to be stressful. The key is knowing the right phrases and being specific about your symptoms.
We covered essential phrases like I'm looking for something for, I've had it for, are there any side effects, and just to confirm. These will handle most pharmacy situations.
Remember to be specific about symptoms. Always mention allergies and current medications. Ask questions when you don't understand, and follow dosage instructions carefully. Your health is too important to be shy about.
Key grammar point. Use present perfect for ongoing symptoms. I've had this for 3 days, not I have this 3 days. Use for with duration and since with starting points.
We'd love to hear from you. Drop a comment telling us, what's the most challenging part of pharmacy visits for you? Or share a funny pharmacy miscommunication story. We've all been there.
And next week, we're covering something equally important. English at the doctor's office, from booking appointments to describing symptoms in detail. You won't want to miss it.
Thanks for listening to Real Talk English. Remember, clear communication about your health is essential, and you now have the tools to do it confidently.
Bye, everyone.